Elon Musk's Neuralink has begun recruiting for a clinical trial director, bringing it one step closer to developing technology that could connect the human mind directly to devices. Neuralink's goal is to build something called a brain-computer interface that allows people to transmit and receive information between their brain and a computer wirelessly, according to Neuralink's website. So in this video, we are going to talk about putting a chip in your brain. Neuralink. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. The human brain is said to be the most complex biological structure ever to have existed. And while science doesn't fully understand the brain yet, researchers in the expanding field of neuroscience have been making progress. Neuroscientists have made substantial inroads towards mapping the complex functions of the brain's 85 billion or so neurons and the 100 trillion connections between them. Enter Neuralink, a Silicon Valley startup backed by Elon Musk that has developed a neuroprosthetic device known as a brain-computer interface. Among other things, Musk claims this chip could cure tinnitus, the neurological condition that causes ringing in your ears, within 5 years. The idea of a brain-machine interface is not new. Scientists have been working on them for decades, and they have been implanted and tested in animals such as monkeys, as well as in people. There are some FDA-approved deep brain stimulation devices meant for, among other things, controlling tremors in people with Parkinson's disease, and several tech companies have worked on their own methods for connecting the brain to computers. Facebook, for instance, has worked on a non-invasive device to let you send text messages by thinking. As the clinical trial director, you'll work closely with some of the most innovative doctors and top engineers, as well as working with Neuralink's first clinical trial participants. The advert for the role in Fremont, California, says. You will lead and help build the team responsible for enabling Neuralink's clinical research activities and developing the regulatory interactions that come with a fast-paced and ever-evolving environment. Musk said last month he was cautiously optimistic that the implants could allow tetraplegic people to walk. We hope to have this in our first humans, which will be people that have severe spinal cord injuries like tetraplegics, quadriplegics, next year, pending FDA, Food and Drug Administration approval, he told the Wall Street Journal's CEO Council Summit. I think we have a chance with Neuralink to restore full body functionality to someone who has a spinal cord injury. Neuralink's working well in monkeys, and we're actually doing just a lot of testing and just confirming that it's very safe and reliable, and the Neuralink device can be removed safely. Neuralink's first clinical trials with a small number of human patients would be aimed at treating paralysis or paraplegia, the company's head surgeon, Dr. Matthew McDougall, said. Neuroscientists unaffiliated with the company said the presentation indicated that Neuralink had made great strides but cautioned that longer studies were needed. Musk presented what he described as the 3 little pigs demo. Gertrude, the pig with a Neuralink implant in the part of its brain that controls the snout, required some coaxing by Musk to appear on camera, but eventually began eating off a stool and sniffing straw, triggering spikes on a graph tracking the animal's neural activity. Musk said the company had 3 pigs with 2 implants each and also revealed a pig that previously had an implant. They were healthy, happy, and indistinguishable from a normal pig, Musk said. Musk described Neuralink's chip, which is roughly 23 millimeters, 0.9 inches, in diameter, as a Fitbit in your skull with tiny wires. During his presentation, Musk said Neuralink aims to make the surgery for the company's implant equivalent to a LASIK type of thing where you sit down, a machine does its thing, and you can walk away within a few hours, all without a hospital stay. He spoke about the wires that would be implanted under a person's skull as threads. A robot for implanting them would bypass blood vessels and cause minimal trauma, he claimed. It sounds simpler than the way people receive implants today. Essentially, as things work now, the skull is cut open, the brain is exposed, chips are installed, connectors are mounted to the skull, and the head is stitched up. Yet the reality is that implanting a device underneath the skull will remain brain surgery. Neuralink acknowledges it will still need to bore a hole in your skull, for instance. The main aim of the Neuralink is to provide a direct connection between a brain and a computer to overcome the power of artificial intelligence, AI, using a sewing machine-like device to stitch threads to an implanted brain chip. Musk recently said that Neuralink's brain chip technology would allow people to stream music into their brains effortlessly. Musk confirmed the feature recently over an exchange with a Twitter user who asked, "If we implement Neuralink, can we listen to music directly from our chips? Great feature." Musk replied with a simple yes. Musk has often criticized the over-reliance on AI and the potential danger it poses. He recently claimed that AI will be vastly smarter than any human and would overtake us by 2025. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Stay safe, and we will be back soon with another video.